Welcome, everybody. Thank you so much for downloading our initial episode of the Climb Institute for Health Professionals podcast. My name is Pete Wright, and I'm here with the IHP director, Sheila Messerschmidt. Sheila, how are you today?
I'm doing great. Thank you.
Sheila, I'm so glad you were able to take the time out of your busy schedule to talk with us a little bit about what we aim to cover in the series that we're launching here in communicating with our students. I wonder if you could share a little bit as we open up. What exactly is the Institute for Health Professionals, and how do you serve the broader health community?
Sure. Well, IHP is one of the business units at Climb Center for Advancement with Portland Community College in Portland, Oregon. And we've been part of the college for 25 years now, primarily providing continuing education for health professionals in the field. In terms of the areas that we cover, we have 9 broad program spots. We're the largest training center in Oregon for the American Heart Association, which is a huge piece of what we do. Professionals in the field have to be recertified every 2 years, and so we help them accomplish that. We have an emergency medicine critical care area, which covers basic and advanced critical care nursing series, for example. We have ENA or emergency nurse courses, and certainly our paramedic refresher. Lactation management is an area that some of our nurses have been interested in terms of cross-training to become consultants. We have a healthcare interpreting program. More and more, we're finding that folks who are getting into a healthcare situation where they don't have sufficient support, interpreting between the professional and the non-English speaking person. So we're striving to assist in providing academic training for folks who want to go into that field. And in Oregon, certification is going to be required very soon in order for the hospitals to receive Medicare and Medicaid reimbursement. So we're very in tune with that burgeoning need. Special topics area is kind of a catch-all for a wide variety of courses. You could think chronic wound management, floor nursing fundamentals, and the like. We do have a couple of entry-level programs because folks are perhaps moving from one career to another and they're wanting to retrain, or for folks that are wanting to get into the health field on an entry-level basis. They're oftentimes coming to us to say, how can I best accomplish that and then grow my career from there? So we work with those folks as well. Certainly there's a business side of health. Somebody's got to code that doctor's appointment that you had to make sure that it gets to the insurance company correctly and the physician is reimbursed and you're charged appropriately. So we train folks in that area. Certified nursing assistant, big program, always a need, particularly if you see our aging population, the health scenario in terms of geriatrics and we're just living longer. We need more and more certified nursing assistants to help folks in that environment. And then a great fun area for us right now is alternative medicine. We started with a nutritional therapy program in an on-site, on-the-ground environment, and we had such success and interest from folks outside of the state that this fall we started an online program in nutritional therapy and added subsequent opportunity in terms of herbalism. And in both of those, students can move toward a certification status if they choose. So in a high level, broad sweep of the brush, that's what we do at IHP.
Well, it's such a wonderful sort of a program, and especially when you look at things like the alternative medicine and the healthcare interpreting. When you look at what normally would be sort of a professional track, get people certified, continuing education kind of a program, and then you have this sort of other context here. You look at alternative medicine and bringing in these alternative healing topics into the certification program that Climb has been, or that the Institute for Health Professionals, I should say, has been so successful at delivering to the community over the years. It's so wonderful to see that, to see the topics of educational delivery in the professional context evolving, and to see IHP at the head of it. So we have this new sort of show that we're experimenting with. And we're very excited about this show because there are so many of these topics and so many different sort of ways to be informed about sort of your opportunities if you're interested in getting involved in the field of healthcare. What is your interest in actually delivering this show to the public? Who would you like to see listen to this show, and what would you like to see them get out of it?
Oh, thank you. Well, we're viewing this as somewhat of a threefold intention. One certainly is to showcase experts in the field of healthcare, because we are blessed, not only in the region, but certainly in this country, with research and academics who are training wonderful people. And then, of course, the caregivers themselves. We want to capture some of that great knowledge and passion for their field, and to provide that information to our constituents. And who are they? Obviously, they're our students, but we want to look far more broadly than that in terms of being a place where folks come to when they want more information about a certain topic. So we showcase the folks we know. And then secondarily, the people who are listening to our podcast can get a hold of us and say, hey, we'd like to know a little bit more about this. That opens up another world of opportunity for us in terms of finding those experts and then providing that kind of content. Secondly, we want to target healthcare topics of interest to our constituent base, which I was pretty much referencing there. We know that they can get a lot of information on the internet and so forth in certain areas. For example, diabetes is very prevalent. Gluten-free diets are a hot topic right now. Growing more and more is a concern over childhood obesity. But there are a myriad of health issues that we haven't touched on or don't have a forum for sharing. And hopefully the topics we include will not only impact these listeners' health and maybe provoke a motivation to make changes, but also to pass that on to others in their families and their neighborhoods and their community. And then thirdly, we'll of course feature some of the educational opportunities that are provided here at the Institute for Health Professionals. Our courses are directed in large part at professionals already in the field, needing continuing education and American Heart Association certification. However, we also have a handful of these entry-level health opportunities that I referenced that are for individuals just beginning their work path or those looking for that career change. The podcasts we're hoping will provide an opportunity for the instructors to speak to their topic, and for those individuals interested in that topic, they can kind of get to know the instructor before they actually come to class. We've got a wealth of amazingly talented professionals who are currently practicing in the field and are choosing to share their experience and commitment to healthcare with our learners.
That is such a wonderful intention. There is, as I think you've brought to the table here, there is this conversation that we establish in the classroom. There's this. It's a very powerful kind of a relationship in the community at the Institute for Health Professionals, and this is a way to broaden that conversation and allow folks to connect with IHP at a new level before, during, and after their experience
exactly
in the classroom. This is wonderful. We will have I should say predictively, we will have a number of ways for you to reach out and connect with us on the show and ask questions and help, we hope, to guide the conversations that we begin to share here on this show as we introduce you to more and more of the professionals who are working in the classroom at IHP. So stay tuned at that. We don't have many of these channels are still sort of being built, and so stay tuned. We will have we will be able to tell you where you can come and comment and post and share your thoughts and stories with us that we can then reflect back to the broader IHP community. But until then, we just deeply thank you for downloading and meeting us, me, Pete Wright, and Sheila Messerschmidt, director of the IHP program with PCC Climb, and we're thrilled to be able to start this new conversation with you. Thank you so much for listening. Sheila, do you have anything else you think I've missed so far?
No, I just reiterate what you've said in terms of how excited we are about this opportunity, and we are looking forward to this being a conversation.
Thank you so much, everyone, for joining us. On behalf of Sheila, again, my name is Pete Wright, and we will be back with you very, very shortly. Stay tuned, and if you catch us in iTunes, the show will be listed in iTunes. Make sure you subscribe, and if you are excited about this conversation, as excited as we are, we encourage you to leave us a favorable rating. A 5-star review is extremely helpful in actually helping other people discover the show and learn more about the healthcare community that exists right here in Portland. So, thank you so much, everybody. We'll catch you next week.